A migraine is an extreme form of a headache that people can be regularly diagnosed with. Though migraines themselves are incredibly common, very few people are diagnosed with having frequent migraines. These forms of headaches can be caused from countless different types of stimuli, including hunger, thirst, or even lack of sleep. People typically become sensitive to light, sound, and other forms of similar stimuli when having a migraine. Someone who may be diagnosed with recurring migraines may experience warning signs or auras before each headache. Auras will be covered shortly, but for now, it is good to know that they can be summarized as a warning sign to an incoming migraine attack. Though they can be referred to as warning signs, the correct way to refer to a warning sign before a migraine attack is an aura. An aura, according to the American Migraine Foundation, is a series of sensory disturbances that happen shortly before a migraine attack. They cannot be explained easily to someone who has never experienced a migraine attack, although the following image allows for a better understanding. This is what a person who may suffer from frequent migraines may see before they have an attack. In more technical terms, an aura can be categorized into three sections: vision disturbances, seeing zigzags, dots, sparks, and blurring; sensory changes, feeling tingling sensations, numbness of the face, hands, and shaking; and speech or language problems, the inability to form sentences, slurring, mumbling, and smaller vernacular. Migraines are a combination of many factors as to when, why, and how they may take place. Some common causes for migraines include, but are not limited to, the lack of sleep, hunger, dehydration, flashing lights, hormonal changes, certain foods and/or drinks, stress, and even exercise. For some people, only one of these things can cause a migraine. To others, each and every factor could lead to a migraine, showing just how mysterious migraines are. A migraine attack can range in its severity from person to person. Some people become ultra sensitive to different things than others. Other people just need to take a nap. In fact, sometimes a migraine can cause people to become more productive so they can take their minds off of the pain. Typically, though, a migraine attack consists of a throbbing or pulsating sensation on one side of the head. The pain can typically be felt on one if not both sides of the head behind the eye of the affected side. After or before a migraine, someone may experience nausea, vomiting, and extreme sensitivity to light and sound. Although migraines vary from person to person, there are many similarities from person to person when it comes to migraine attacks and their symptoms. To begin, a migraine has to be triggered by something. This something can be a chemical imbalance, a natural biological function, or as simple as a lack of food or water. When triggered, neurons send triggers down the trigeminal nerves, a major pain pathway that goes from your brainstem all the way to your teeth. The blood vessels then begin to dilate and expand in response, causing some of the throbbing sensation you experience. Activity then occurs across the brain, advancing like a thunderstorm. As the activity spreads, blood vessels constrict and limit oxygen flow to the brain. This is called a cortical depression. Cortical depressions are responsible for the auras that people with headaches experience. From the brainstem, the brain sends chemicals including serotonin, noradrenaline, prostaglandins, and other neuropeptides to the outer layer of your brain, which results in inflammation and swelling of blood vessels. This increase in activity is what explains the throbbing pain we experience in a migraine attack. After 1 to 2 hours, the pain in the migraine shifts and the central nervous system becomes hyperactive and gets involved. Before the second stage, you can take a triptan medication, which suppresses the initial pain. It also suppresses any plans you have for the rest of the day. Aloperidol is extremely powerful and prevents you from getting to the second stage. This second stage is just 72 hours of more migraine hell until your nervous system can finally calm down. In short, migraines are terrible. I was diagnosed with having a migraine problem in November of my junior year. They began to get so bad I had to quit the track team because of how immobilizing they became. Though they have gotten considerably better as of late, they never truly go away. They are super strong and can immobilize you for days at a time. They can vary in their strengths, but once I can feel one coming on, I know I have to lay down and curl into a ball to make myself feel better. Personally, my warning sign or aura is seeing what almost looks like a traffic light at night, like the picture, just minus the traffic light and the nighttime. That light pattern is all I can see, and everything looks like that approximately 10 minutes before the attack starts. Also, I have never had a migraine last overnight. Though it is incredibly common to happen, I have yet to experience a migraine attack throughout the nighttime. They typically can go away with time, and for me, sleep. Whenever I get a migraine, I find taking Excedrin, pain medication with caffeine, and eating something really helps me. For other people, sleep, Excedrin, aspirin, or even triptans can help. Triptans are scary though because they relax your brain, which in turn makes you fall asleep within 5 minutes of taking the medication, but they are very effective. Migraines can be treated in a few different ways. They can be treated by taking an over-the-counter painkiller like aspirin, Advil, ibuprofen. Also, you can take a mixture of caffeine and painkiller, Excedrin migraine, for a quick fix. A triptan medication can be used to block pain pathways in the brain, allowing for a migraine to be completely suppressed in minutes. Also, among other ways to treat the migraine, you can take preventatives as well. These preventatives are typically bi-monthly injections to put something in the body to stop the headaches before they start. The substances include blood pressure lowering medications, antidepressants, anti-seizure drugs, Botox injections, and lastly calcitonin gene-related peptide, which is a newly approved drug to prevent migraines.